sometimes even more than words is just being with the person and being silent, but pulling up a chair, saying, tell me how things are going, and doing the hardest thing for doctors and nurses to do, which is shut up. People will tell you. People will say, I am just so afraid of dying. I'm so afraid of being in pain. I'm so afraid of leaving my family. I'm so afraid of missing out on watching my grandkids grow up. So I think active listening is really, really important and not done enough. It's a teachable skill. I mean, when I was still down at the Medical College of Virginia, when I was in charge of the cancer floor, I would make the medical students, third and fourth year medical students, go in, pull up a chair, and talk to the patient for 15 or 20 minutes about anything other than their illness. So they really got to know who this person is. One thing is remembering that cancer or any serious disease is a family disease.
Yes.
So what I teach the fellows and the residents here is you pull up a chair, and at some point during the interview, not the first question, but we usually start with symptoms because they're safe. And then we'll move into, well, who's your support system? Mm-hmm. And try to write that down. And are you a religious or spiritual person? Yeah, I'm Catholic. Have you gone to church in the past couple of years? No, but Father Jim knows me. Has Father Jim called on you? Or would it be okay if I called Father Jim and asked him to come make a house visit? Once you've had some of those conversations and get to know a person, you look people in the eye and say, your life has been turned upside down. How are you coping? And people will tell you, I'm doing the best I can. Every day is terrible. Every day is okay. A lot of people use this as a growth opportunity to say, I've got a limited amount of time left. I'm going to be my best person. I'm going to do some of the things I wanted to do that legacy work. And then after you've talked to the patient, I teach the fellows and residents to physically turn and face the family and say, Mom's been pretty sick for the past 6 months. How are you all coping with her situation? And they'll tell you. I've used up all my FMLA. Now I'm using my vacation time. I've had to drive her to 6 doctor visits in a week. Why can't you get them all together? They'll tell you what's going on with their lives. And I can guarantee that will be the first time anyone has asked them about how they're coping. My own experience, having prostate surgery and then a quick recurrence and prostate radiation therapy and androgen deprivation and having all sorts of side effects. I had a TIA from it, which is associated with the drugs. I lost half my lung function, felt terrible most of the time, just tremendous fatigue. And I went over to see one of the dermatologists, and I get seen in the residence clinic over there, and they have an attending of the day who's monitoring the residents. And he's looking at my chart. He walks in after the residents examine me. They're going to burn a basal cell off my leg. He's looking at my chart, and he's saying, you had a pretty tough year. How are you coping with that? And it's the only time in my cancer history I've been asked that question. And I said, Well, frankly, it's been a pretty crappy year. That's not exactly the word I use. It's been a pretty crappy year. And you could tell he just physically backed up. He was completely uncomfortable with taking it from there on in. And he said, "Where's that spot on your leg?" That was his response.
Yeah.
So teaching people to ask about coping is really important. When Jennifer Temmel did her lung cancer study at Mass General, where she took 157 lung cancer patients, half of them got usual care, and half of them got seen by a palliative care nurse practitioner or doctor once a month. She had one of the medical students or residents go through the charts and look at how many times coping was mentioned. And there wasn't a single instance in the oncology alone charts of asking about coping. So that's something simple and easy you can do.